Hey everybody, Brian Boyle here, and welcome to episode 134 of the Mesh Tongue. And it is Sunday, so happy Mother's Day to all you mothers out there, and all you other sexy mothers. Hey, that's all I got. It's a fantastic day here in Utah. We're expecting snow later this week, so hopefully you're not expecting snow like we are, but something to look forward to in our part of the world for at least the next week. I mean, they're saying almost a foot in some of the canyons. So much for spring and summer being around here anytime soon. But hopefully you have better weather, like I said, and hopefully you're enjoying your spring. Hopefully you get a chance to spend time with your mother. My mother, unfortunately, is no longer with us, but I have a lot of mothers in my life, and I certainly appreciate them. And so, hey, happy Mother's Day to you. You know who you are. And hey, without further ado, today I want to talk to you briefly, because it's just going to be a short episode, because it's Mother's Day. It's a holiday. I spend time with my wife and my mother-in-law and this grandmother and some other folks. But I want to talk to you the difference between hamstrings and low back pain. So I've talked about each of them separately. If you go back to episode 43, 44, and 45, I've outlined hamstring protocol, phase 1, phase 2, phase 3. In 42, episode 42, I talked about low back. So now I want to talk to you about how is the differential diagnosis. How do you know if it's actual hamstring versus low back and referral pain into the posterior thigh? So this is something that will be important for you as you're looking for, how do you go about with different options. Obviously, you can always come in and see somebody like myself, but if it's not an option, you live elsewhere where it's just not feasible, or it's just not viable, you're just too busy, these are the sorts of things you're going to look out for. So you're running, you have an injury, and if it is sudden, if you hear a pop, okay, it's usually the fact that it's usually something very proximal up towards the ischial tuberosity where the hamstring origin is. These are pretty bad. The closer it is to the ischial tuberosity or that bony part of your butt, okay, that's going to be a higher likelihood of a long-term recovery. If it's something further down into the middle of the muscle, usually a much faster recovery. What you'll notice also is that's going to be really, really painful to the touch in the muscle. So, you'll kind of grab the back of your leg and it's really sore right there. This is how you can differentiate something that's referral pain, not going to be sore in the muscle itself. Okay, so typically if you've got like an SI joint dysfunction or something coming from the piriformis and shooting down, this referral type pain, maybe it's coming from the quadratus lumborum, muscle right up at the top of the pelvis. These are going to shoot down. You're going to get this posterior thigh pain. It's going to feel more like an achy, dull, gnawing, not a real sudden, painful, kind of pain. You'll have strength loss typically with a hamstring, and it's going to be probably pretty severe. That you're going to not be able to kind of flex the leg back. So try and apply pressure, just digging your heel into something, you're gonna notice, and it's gonna be really, really painful. If it's a referral pain, probably not so much. Gonna be mild. You might have some pain, but maybe not even any strength loss at all. Just have this kind of referral pain. A slump test where we actually stress the sciatic nerve. So what you'd do is you would slump down, you would actually take the chin, tuck it in, you would lean forward, and then you would extend the leg out. And what you're doing at this point is you're trying to stretch that sciatic nerve. If you had an SI joint issue or kind of a low back issue, probably this is going to be very positive. It's going to be painful. It's going to feel like an electric shock going down the leg, maybe to the knee, maybe a little bit further depending on if it's piriformis. Hamstring, not so much. Even though you're stretching, it's not going to have that immediate and sharp pain like this zinger would. Gluteal trigger points, so the next thing would be if you've got these trigger points, if you're reaching around and you're touching back into the glute, you're probably going to have some trigger point pain if it is low back or piriformis or SI. These things, again, you'll cause an increase in the pain. So as you're pressing there, you'll feel this comparable sign, as we like to call it, and that comparable sign will actually shoot symptoms down into that referral area. If it's a hamstring, you're not going to feel much. You're not going to have much of those trigger points. Yes, you could have some trigger points, but they're probably going to be very mild. Nothing that's going to be a zinger down into the rest of the leg. And if we do an SI joint exam where we're actually looking to see what the pelvis is doing when you're bending forward and what compression, okay, you're going to be positive for a lot of these tests that we're going to do on an SI joint examination. And how you would do that at home, well, you figure that you probably wouldn't be able to. Okay, so I'm just kind of reading, down this list in my mind of what we would be looking for. All right, hamstring, you wouldn't have any positive tests for SI joint dysfunction. And then imaging would be, if you decided to go get an MRI, imaging would be very abnormal for a hamstring. You'd show this kind of this hot spot where the tear is, and it would more than likely be negative. And this is one of the things that maddens everybody. They get frustrated. They go, I just went for an MRI, or went for an X-ray, and everything comes back negative with the SI joint, which again isn't necessarily a bad thing unless you don't have somebody that knows what to do with something that comes back negative. I do that all the time. That's what we do. Your X-ray or your MRI comes back negative, we get you feeling better. Comes back positive, well, and sometimes there's other options that are out there. But that's really the name of the game. Folks, if you're out and about and you do suffer a hamstring injury, don't stretch it. Don't stretch the hamstring. It's the recurrence rate of re-injury is much higher if you start stretching. Let it kind of scale down a little bit. You can foam roll if you want to. You can take the stick or the tiger tail and massage that out. All right, you can start working on that. You can gradually return to running. You can go through those phases as we've talked about. Gradually speaking, if you're having pain longer than a day, okay, then you'd want to start going through phase 1 and then phase 2, phase 3. Again, you can find those videos in the Mesh Tongue, episode 43 through 45. If you are having issues where it's your SI joint, I would highly encourage you to get in to see a physical therapist that's trained in manual, techniques. Muscle energy works really, really well. I've actually had some people write into me, and I've shown videos for muscle energy to reset the pelvis, and then sometimes we have to reset the pelvis and to do the hamstring protocol. So again, if that's the case, I'll be more than happy to try and walk you through that. We can do whatever we need. But that's it for today. That is episode 134 of the Mesh Tongue. Again, happy Mother's Day to you, and we'll see you again tomorrow. Check out runpainless.com, and please, whatever you do, don't go hurting yourself to come back, but always share this with your friends, family, training partners, and until tomorrow, I'll see you again. All right.